I was diagnosed with, breast cancer about 5 years ago, and I didn't have any problems sexually or with my pelvic floor that I was aware of at that time, and I went through a lot of chemo and radiation and surgeries, and because my cancer was hormone fueled, they had to pretty much shut down my hormones, put them on lockdown, and with that really hurt my other aspects of my life, where my intimate relationship, sexual relationship with my husband was put on hold because I either wasn't feeling it, I didn't have any type of libido, there was nothing, and it almost felt like after a few years of not having an intimate relationship physically that I wanted to get help or figure out what I needed to do to help myself.
Okay.
I was having a problem with having intercourse with my husband, even just being able to get there. I felt like there was a block down in my pelvic region, and I just got to a point where I wanted some help, and I wanted to kind of get back to normal life after being diagnosed and going through treatment for breast cancer. And I was at a point where I really wanted to find some help so that I could have intercourse with my husband again, and have it not be painful, and have it not be just a discouraging event. I was at a point where almost desperate, I would say, I want to be able to have a working vagina.
Gotcha.
I was really just eager. I was eager to try something new, and I never even heard of pelvic physical therapy, and so I thought, why not? Let's try this out. And I was pretty excited after our first conversation over the phone. So when I spoke with the therapist at Fundamental Physical Therapy, I was very encouraged and hopeful after our conversation, just realizing that there would be a possibility that I could have intercourse with my husband again. It had been such a long time, and with all of my hormone suppressed medications, it made intercourse impossible, or what I thought was near impossible, and it has really helped, because I feel like I have been able to listen to my body and learn what my body can do while using the tools that the therapist gave me.
Cool.
At first, what pelvic physical therapy is, I never really thought about what that could mean, if it's just outward exercises or the internal work, but I would say that throughout all of it, I've been very comfortable and felt safe, and that the therapist was very communicative and really there to support me and my journey through this. And I never felt pressured to have to be at a certain place. It was all just working on my timetable, and that was very nice to have. I feel like even after the first and second and third sessions, just the amount of progress that I was able to make with during therapy and my exercises at home. I felt that I was in a I guess I felt supported and felt that I had the right types of tools to help make intercourse possible again. So I feel like I've made great strides since beginning this, 5-6 months ago. I've just recently been able to attempt intercourse with my husband again, and that was huge and encouraging because this has been a marathon of just slowly working with my body and being patient, and it's possible. And I'm excited for for what's to come, because I feel like we're right there. For anyone who is on the fence or trying to figure out what their next step should be as far as having difficulties like I have, I would highly recommend jumping right in. It has really helped me out a lot, and I would say just to go for it. It's very, I don't know, I would say it's encouraging to know that there are things out there that you can do, that you can work with your own body and become more in tune without having to, be in pain all the time. Like, it doesn't need to be painful.